Hi guys. All right, listen, first of all, thank you for watching this video. I think it's very, very important for everybody to watch this. For starters, in case any of you don't know who I am, my name is Anthony. I am the 2023 Builders T Club Secretary, and infinitely more important than that, I'm the guy with the AED. All right, the automated electronic defibrillator. I have the AED in the golf cart with me every Tuesday while we're golfing. Right, so a lot of you already know that. Now, if you're watching this, you know that, and you know to call me if somebody has a suspected heart attack, and then I'm going to come. But what you really need to know is that there's more that you need to be doing. Okay, because it's going to take me a few minutes to get there, and if there's a cardiac event, somebody having a heart attack, every second that nothing is being done, we are drastically reducing our chances of survival. Okay, and even if we are lucky enough that they survive, there's a greater risk of brain damage or other problems. All right, that's just firehouse noise. Now, before we get going, though, I think I probably should have some sort of a disclaimer here because I'm doing this at the firehouse. I have to make it very clear that this is in no way at all endorsed by or sponsored by the fire department, the American Medical Association, American Heart Association, or any other public entity. This is just one Builders team member talking to other Builders team members. All right. And if anybody's not a Builders team member and you're seeing this video and you want to throw some smart-ass comments in about how I'm not being specific enough or detailed enough, it's not supposed to be that kind of a video. This is like the equivalent of meatball surgery. All I'm doing here is trying to tell you guys what you can do to help increase the chances of survival if one of your playing partners has a suspected heart attack on the golf course. All right, so usually we play golf in foursomes. Okay, I almost forgot the number. All right, so that means that there's 3 of you that aren't having a heart attack, and every one of you should be doing something. Okay, first person, call 911. Right? Call 911, tell them what's going on, tell them where you are, let's get that EMS system rolling, all right? And then as soon as you get off the phone with 911, then call the clubhouse, let them know what's going on, let them know that there's an ambulance on the way so that they can have somebody out front ready to escort the ambulance to where you are, all right? That's person 1. Second person, call me, all right? I've got the AED. I can probably get there before the ambulance, okay? I have been trained with the AED. I'm trained in CPR. I've been a Chicago firefighter for almost 20 years. So there are things I can do to help. Okay. The third person. Okay. You're checking for pulse and breath. All right. If there's no pulse and they're not breathing, then you need to start CPR. Not full-blown CPR right now. We're really talking more compressions, and I'm going to get into why. I want to backtrack a little bit as far as calling me. You should all have my phone number in your phone. All right, it's in the members book that Larry Goretto handed out last week at Silver Lake, and also at the end of the newsletter. All right, at the end of my section, the first page, the phone number is there. And I would suggest that rather than putting it in with my name, put the letters AED with it. All right, you can have AED Anthony or just AED. But if something happens, all right, in the heat of the moment, you might forget who's actually carrying the AED, but you won't forget those letters. All right, it'll be easier to find the number if you go right to AED. All right, now you check for breaths, you check for pulse. If there's no pulse, there's no breaths, you're going to start the compressions. All right, now a lot of you might be thinking, I don't know how to do compressions, I haven't done CPR. That's what this is about. That's why this is a very basic tutorial. It's not going to be a full-blown CPR class. We're not going to get into ratios of compressions to rescue breaths or any of that. Right? We're focusing on compressions here. We're not going to worry about the rescue breaths, otherwise known as mouth-to-mouth. Reason being, compressions, what they do is they help to pump oxygenated blood to the heart, the brain, other vital organs. Okay? The rescue breaths, or the mouth-to-mouth, what that does is that puts oxygen into the blood. Now, you were golfing with the guy, he went down in front of you, which means just seconds ago he was breathing, so that also means that for at least a short period of time, there's plenty of oxygen in his blood, and we just need to focus on the compressions. Okay, now as far as the compressions go, remember the number 2. All right, that's how I simplify this for you. It's all about the number 2. What we need to do is think about that in a situation where, all right, everybody has 2 hands, everybody has 2 nipples. That's vital to this, okay? When you're doing compressions, you want to use 2 hands centered between the 2 nipples, right on the sternum, okay? 2 hands between the 2 nipples, all right? You want to compress at a depth of 2 inches, and you want to try to do it 2 times per second. Those are all the 2s. 2 hands between 2 nipples, 2 inches, 2 times per second. All right, now what's also very important is we don't want to just be doing that, okay? We're going to go down that 2 inches and then come all the way back. Down 2 inches, come all the way back. Reason being, that's going to get you the best blood flow. If you're just pumping really fast, you're not really moving a lot of blood. It's very important, okay? Now as far as how to position your hands when you're doing the compressions, like I said, it's 2 hands between the 2 nipples. A lot of people are always going to teach, clasp your fingers, use the heel of your hand, all right? And that's fine. Myself personally, when I do CPR, I do better with one hand over the other, but still always using the heel of the hand. The palm and the fingers are not going to do nearly as good a job as using the heel of your hand. Okay, and then also when you're doing it, not just pumping your arms, okay? You're here, you're doing that. It's harder to do good compressions, and also you're going to get tired a lot faster because you're just using your arms. It's like anything else. What's going to help you last longer when you're doing something strenuous, just using your arms or using your whole body? So in this scenario, you're going to be there, and okay, you go up and down, up and down, up and down. You want 2 per second, but use your shoulders, okay, use your back up and down, all right? That's very important. Okay, so once again, 2s. 2 hands between the 2 nipples, depth of 2 inches, a rate of 2 times per second, full recoil. All right, now also, something else for you to consider is if you've never done this before, you're gonna get tired, especially if you're on a golf course out in the heat. All right, this will wear you out. If you've ever had to do this for a minute or 2 minutes, you know what I'm talking about. So if you're starting, every minute or so, switch out. All right, the phone calls have already been made. You can switch. Somebody else can come in and start doing the compressions. Right? Don't try to be the hero and say, no, I can keep going, I can keep going, I can keep going. Because after about a minute, the quality of your compressions is going to diminish. The best thing to do, get some fresh hands in there, somebody who can do it, all right? You can rotate around, right? Hopefully by the time you've done 1 or 2 cycles, I'll be rolling up with the AED, and we can take these to another level from there, all right? Also, what I want to talk to you about is if somebody's having symptoms, whether it be chest pain, shortness of breath, pain in the left arm, or any other cardiac symptoms that you may know about, don't hesitate, don't wait, don't think, oh, it'll just pass. Start heading towards the clubhouse. All right, make the phone calls, like we said before, call 911, call me, all right, but be heading towards the clubhouse and I'll meet you there, all right? If while en route to the clubhouse, the person who's having the symptoms goes unconscious, don't just keep going because you think it's best to get there as fast as you can, because that's not the best case scenario. What you want to do is stop right there, get them on the ground. Once again, check for breath, all right, check for pulse. If they're not breathing, no pulse, start those compressions, because delaying compressions for you to drive to the clubhouse, that's the same as doing nothing, and once again, we're decreasing the chances of survival, all right? So if somebody's conscious and having symptoms, head to the clubhouse, make the phone calls. If they go unconscious while you're on the way, get them on the ground, check for breathing, check for pulse, start CPR, all right? If while you're at the golf course and they immediately go down and they're unconscious, person number 1 calls 911, then they call the clubhouse to let them know that the ambulance is coming so they can be there to escort them to where we need to be. Person number 2 is calling me. Make sure my phone number is in your phone. Let me know where you're at. I'll be coming. Person number 3 is checking for breathing and a pulse. If they're not breathing and they don't have a pulse, start the compression. What's the number? 2. Remember, it's always the 2s. 2 hands between the 2 nipples, a depth of 2 inches, a rate of 2 per second, get a full recoil up and down and up and down. Something else to remember is there's a chance that you may break some ribs. All right, can't tell you how many times I've been doing CPR, and especially on some older people, their ribs start snapping like twigs. All right, it's not a pleasant thought, but I can promise you this: if they survive, all right, and your CPR helped save their life, I don't think they're going to give a shit about a couple of broken ribs. Right? So now also a couple more things I want to mention before we end this. I don't want to make this too long. But one thing is, don't think you're too young or too healthy for something like this to happen to you. All right? We have professional athletes dying of heart attacks. It can happen to anybody at any age. All right? All the years I've been on the fire department, I've seen people have heart attacks, and we've had people with cardiac symptoms, 20s, 30s, 40s, all the way up, even teenagers, okay? So people you think are the picture of health. You don't know what's going on in there, so don't ignore any symptoms, whether it's at the golf course or at home or wherever you are, all right? If you got family, friends, and loved ones, don't let them ignore symptoms, okay? If you're having any kind of cardiac symptoms, seek medical attention right away. Don't you think, and don't let anybody else think that they're ever too young or too healthy for something like this to happen to them. All right? I appreciate very much that you watched this video. It can be vital to the survival of one of our other members if something happens on a golf course, or also you can bring the same practices into your real life. If you're with a family, friend, or loved one, and they happen to go unconscious, you at least have a basic guideline how to start doing compressions, and you can increase the chances of survival while you're waiting for EMS to arrive. All right. I've said it before in a newsletter. I've told people before. This is only about my third year in the club. I love the Builders T Club. I love all the members, and I want to be able to enjoy your company on the golf course, in the bowling alley for many, many years to come. So thank you all for listening. God bless all of you. I'm out.